Today I'm going to address the question that once you are invited by your psychologist or your psychiatrist to come to an informational care session as the person himself who's struggling with a mental illness or somebody who is carer of a person who is struggling with mental illness, what should you ask and how the structure of that session should look like and what to expect. The first of all, the session should include some information on the illness. If there is a particular label, but that's it, that's not necessary really, but it's just some information regarding explanation regarding the symptoms of the illness, the changes in thoughts, emotions, and behavior of the person suffering. What should that person himself or herself expect, and what should the family or the carers expect? Then comes the treatment. There are multiple modalities or combination, but mainly we know two, or we are going to talk about two in that session. What are, if there is a drug treatment, what does that entails, and if there is therapy is the mode of choice, then what to expect in those sessions. And sometimes we use combination of both. And then there are multiple other things that are included in terms of treatment. And then number three, you should expect the doctor or the psychologist or the psychiatrist, whoever is treating that person, to talk about his or her role in that treatment. And then comes the role of the family and role of the collaborator himself or herself. And regarding the taking care of carers, that how they should take care of themselves is that they should be taking care of themselves, having a good enough lifestyle, getting enough sleep, getting enough hydration, eating meals at appropriate times. And then there are certain psychological aspects that include stress management, problem solving techniques, ventilation of emotions. Regarding that person who is sick, you can have guilt, you can have sort of frustration, you can have ambivalence towards that person. So all these emotions have to be taken in account and dealt with, and should be discussed with the person who is in charge, meaning your therapist. And then there are two types of things that we specifically I want to talk about, is that how you're going to treat that person who is sick in the house. And I'm specifically talking about those who are chronically ill, and it's a burden on carers day in and day night to take care of those people. So there are two types of responses that we see. One is that carers become dissociative or apathic towards that individual, the problematic behaviors. And the second one is that they become hostile, critical, or emotionally over involved in sort of a positive way, but too involved for their own good or for the good of that person. So one also ask on that in that session from your therapist about contact hours with the that particular person who is suffering from mental illness. It should be roughly around 35 hours per week. And also ask about how to behave with that person, how when the person is angry, when that particular person is quiet. And I'm not typically talking about those people who can take care of themselves, like they're suffering from depression or anxiety of moderate level. In this specific aspect, I'm particularly talking about those who are more ill than are and they can and are ill for a longer time period, and they are not sort of aware of themselves or their surroundings. They don't have insight regarding their illness. That becomes more problematic for the families to deal with. And in that regard, you need to collaborate with whoever is available in the family and take turns taking care of that person.